to actually get into our guest panelists. Tonight, we're really very fortunate to have two integrative health experts, Dr. Sheba, as well as Dr. Jeffrey Mensah. We have worked together numerous occasions in the past. We're very fortunate to have them. They know more about this topic than I could ever hope to know, and that's why they're here, and I'm not going to be talking. So I would really like you to just spend a moment, Dr. Roy, if you could start out and tell us a little bit about your education, your training, and a little bit about your passion.
I was saying that I have a doctorate in natural medicine, as does Dr. Mensah. Both of us did residency in family practice with extended family practice hours. And I did my fellowship in something called integrative oncology. A fellowship is where you become an expert in a specific kind of thing and learn to forget everything else. And I did that in Philadelphia with Eastern Regional, Hahnemann University, and Cancer Treatment Centers of America. And Dr. Mensah did the same. He's now in his second year of a 5-year fellowship here in Michigan. We recruited him because of his interest in men's health, and our hope is that he subspecializes in prostate. So when I say integrative oncology, I think it's worth explaining what that means, Dr. Lutz, if you think the same. Can you hear me okay?
I can hear you perfectly.
Okay, perfect. So integrative oncology is a term that means our job is to offer supportive care for patients who have been diagnosed with cancer or are going through cancer treatment, to prevent side effects from hormone therapy, surgery, radiation, help to mitigate the long-term effects from those things, chemotherapy, if they do need chemotherapy, and targeted therapies, so specific drugs that target different kinds of cancers. Our job is also to optimize outcomes in the long run to lower risk of progression or lower risk of recurrence. And in your population, when patients are in active surveillance, to lengthen the time from which they're diagnosed to when they do eventually need treatment.
And Dr. Mensah, a little bit about your story.
Absolutely. So as Dr. Roy was saying, I do have a doctorate in natural medicines, and I schooled in Chicago with my extended family residency hours. I took a special interest in men's health as well as cancer care, and post finishing those hours, I really wanted to find the overlap or the intersection where I can take both oncology care and then also men's health to treat patients.